Hello viewers, this is Dr. Rajiv. Welcome to your education channel YouTube Surgery and Orthopedic Education. Please consider subscribing to it and sharing it with your near and dears to help them prepare not only for the MBBS course but also for other postgraduate and medical job entrance examinations. Please don't forget to hit the bell icon below so that you never miss useful lectures from us. This video will teach you 10 NEET PG entrance level multiple choice questions on gallbladder and bile ducts with explanations and descriptions. These may be useful for the foreign medical graduate examination as well as for combined medical services examination. The questions will appear first with a 5-second timer and explanation and description will follow. Now let us not waste any time and start right now. The correct answer in question 1 is option B. Biliary atresia is a rare disease of neonates. It is characterized by the inflammatory obliteration of intrahepatic and extrahepatic bile ducts. In biliary atresia, bile ducts are progressively destroyed by an inflammatory process that starts around the time of birth. If remains untreated, death from liver failure occurs before the age of 3 years. Liver function tests show an obstructive result with elevated serum bilirubin and alkaline phosphatase. Liver biopsy is the gold standard for the diagnosis of biliary atresia. Once the diagnosis is suspected, an operative exploration with intraoperative cholangiography is indicated. If biliary atresia is confirmed, a hepatoportoenterostomy or Kasai procedure is the procedure of choice. In the case of a choledochous cyst, radical excision of the cyst with Roux-en-Y reconstruction of the biliary tract is the treatment of choice. In Caroli's disease, cholangitis and jaundice are treated with antibiotic therapy followed by endoscopic or interventional stenting. The correct answer in question number 2 is option C. Meiji syndrome is a rare biliary disease. It is caused by the obstruction of the common bile duct or common hepatic duct by external compression from multiple impacted gallstones or a single large impacted gallstone in Hartmann's pouch or cystic duct. Presenting symptoms are similar to cholecystitis, but this condition may be confused with other obstructing conditions such as common bile duct stones and ascending cholangitis due to the presence of jaundice. The treatment of choice in uncomplicated cases is a laparoscopic cholecystectomy. But if a fistula has found, then an open cholecystectomy with a Roux-en-Y biliary reconstruction is required. The correct answer in question number 3 is option D. Infestation of the biliary tract by adult helminths or their ova may produce chronic recurrent pyogenic cholangitis with or without multiple liver abscesses, ductal stones or biliary obstruction. Trematodes or flukes including Clonorchis sinensis, Opisthochis viverini, Opisthochis felinis and Fasciola hepatica are the organisms most commonly involved. The biliary tract may also be involved in the intraductal migration of adult Escherichia lumbricoides from the duodenum or by the intrabiliary rupture of hydatid cysts of the liver produced by Echinococcus granulosus. Ankylostoma duodenale, commonly known as hookworm, may cause iron deficiency anemia, not a liver disease. The correct answer in question number 4 is option B. The most common indication for therapeutic ERCP is obstructive jaundice from biliary obstruction due to gallstone disease and benign or malignant biliary strictures. The gallstone is extracted after an adequate biliary sphincterotomy. If adequate stone extraction cannot be achieved at the initial ERCP, biliary drainage with the placement of a removable plastic stent is considered. Alternative options are surgery, endoscopic as well as extracorporeal shock wave lithotripsy followed by repeat ERCP to remove stone fragments. ERCP is also used for pancreatic disease and the assessment of sphincter of Oddi dysfunction. Indications include pancreatic stone extraction and the dilatation of pancreatic duct strictures. At less equipped centers, open surgery and bile duct stone extraction may be carried out. Complications of ERCP are sepsis, pancreatitis, hemorrhage, and duodenal perforation. The correct answer in question number 5 is option A. The obstructive jaundice occurs due to intrahepatic cholestasis and extrahepatic bile duct obstruction. Here, the serum bilirubin is principally conjugated. Conjugated bilirubin is water soluble and is excreted in the urine, giving it a dark color. At the same time, lack of bilirubin entering the gut results in pale, putty-like colored stools, and there is an absence of urobilinogen in the urine. The correct answer in question number 6 is option D. Resection of hilar cholangiocarcinoma should be guided by medical risk. It is a major operative procedure that requires appropriate surgical and anesthetic experience. Surgical treatment depends on the site and extent of bile duct involvement by the tumor. Intrahepatic cholangiocarcinoma are usually treated by resectioning the involved segments or lobes of the liver. Distal cholangiocarcinomas are managed by pancreatoduodenectomy. The criteria that indicate non-resectability are medically unfit patient, distant metastasis, elevated tumor markers, significant atrophy of one lobe of the liver, and bilateral or contralateral involvement of portal vein, hepatic vein, or secondary biliary radicals. The correct answer in question number 7 is option D. Extensive calcification of the gallbladder wall due to chronic inflammation is termed porcelain gallbladder. It is occasionally seen on plain X-ray and CT scan. It is considered a pre-malignant condition. Traditionally, this is an indication for cholecystectomy. However, the decision to perform cholecystectomy should be individualized depending on the age of the patient, comorbidities, and presence or absence of symptoms because the true incidence of cancer in this condition is less than 5%. The term strawberry gallbladder is used when the inner gallbladder lining looks somewhat like a strawberry. This condition is also known as cholesterosis of the gallbladder. Pathologically, there are submucous aggregations of cholesterol crystals and cholesterol esters. The condition predisposes to cholesterol stone formation. Cholesterol polyposis of the gallbladder is characterized by a non-mobile defect in the gallbladder lumen that does not show an acoustic shadow on ultrasound. It is often asymptomatic. Cholesterol polyposis should be differentiated from an adenomatous polyp. Surgery is indicated only if the dilemma is not resolved confidently. Cholecystitis glandularis proliferans is a chronic inflammatory condition of the gallbladder. Its other names are adenomyomatosis and adenomatous hyperplasia. There is a thickening of the gallbladder wall due to the proliferation of epithelial and smooth muscle cells, leading to the formation of intramural diverticula, usually identified by ultrasound or cholecystography. Generally, no treatment is required. However, if symptoms are severe, a cholecystectomy may be recommended. The correct answer in question number 8 is option A. In primary sclerosing cholangitis, a fibrous obliteration of the biliary tracts affects intrahepatic and extrahepatic bile ducts. This condition often presents between 30 and 60 years of age with mild non-specific symptoms such as right upper quadrant discomfort, jaundice, pruritus, fever, fatigue, and weight loss, plus abnormal liver function tests. There is a male preponderance and a strong association with inflammatory bowel disease, especially ulcerative colitis. Also, there is a strong predisposition to cholangiocarcinoma and gallbladder cancer. Its cause is unknown, but the association of hypergamma globulinemia and elevated serum markers such as smooth muscle antibodies and antinuclear antibodies suggests an immunological basis. A Klatskin tumor or hilar cholangiocarcinoma is a cholangiocarcinoma occurring at the confluence of the right and left hepatic bile ducts. Secondary sclerosing cholangitis is characterized by inflammation, fibrosis, and destruction of the biliary tree due to a stone disease, surgical or blunt abdominal trauma, intra-arterial chemotherapy, and recurrent pancreatitis. The correct answer in question number 9 is option C. The poor prognosis of gallbladder carcinoma is associated with late diagnosis, aggressive nature, anatomical location, subtle clinical symptoms, ineffective adjuvant treatment, and lack of reliable biomarkers. Gallbladder cancer often presents with non-specific symptoms or remains asymptomatic in its early stages. This leads to late diagnosis when the cancer has already advanced. Gallbladder carcinoma tends to be aggressive and spreads quickly to the liver, peritoneal surfaces, perihilar lymphatics, and neural plexuses. There are no effective screening programs for early detection of gallbladder cancer, unlike other cancers such as breast or colon cancer. The question of histological type arises only after suspicion and detection because the majority of tumors are advanced and inoperable at the time of presentation. The correct answer in question number 10 is option D. Bile duct injury is a dangerous complication of cholecystectomy. It has significant post-operative complications in terms of morbidity, mortality, and long-term quality of life. The most common cause of common bile duct injury is laparoscopic cholecystectomy. The injuries occur due to misidentification of the bile duct anatomy during surgery.